importance of protecting the rights of pain patients and people who use opioids for managing chronic conditions. I saw that a lot of the legislation and regulation that was designed to curb overdoses harmed pain patients too. Even well-intended regulatory fixes ignored patients and created massive upheaval in their lives. My long-held fantasy of destroying Purdue had more than one crack in it. Maybe abolishing opioid manufacturers wasn't the answer after all. If anything, I began to see how simplistic my view had been. I grew and listened and did the work and stayed willing. I am incredibly grateful for the people who took the time to educate me, answer my questions, and challenge my long-held beliefs. They prepared me for the journey I took in Unsettled, and I am a better person for it. Learning how to use my voice was difficult, important work. Ironically, just as I felt I was making progress, I opted to silence myself, to do something that was even more important to me, bearing witness to the bloodbath of the Purdue bankruptcy. I agreed to say nothing, but I couldn't shut off my feelings, and in the end I couldn't betray my principles and let these secrets die in darkness. I wrote Unsettled in real time, as the case was unfolding. This book represents how I felt in the moment, as well as where I was in my life, where America was, and what happened during the excruciating Chapter 11 proceedings, Purdue's eventual restructuring, and the Sackler family's exit from any true accountability. This is real, it's raw, and large sections of it are recollected from my memory. I listened to hundreds of hours of testimony and lawyer talk. I sat in countless meetings. I read thousands of documents. At some point, I couldn't keep it to myself. Throughout the bankruptcy, I struggled to keep quiet. It made my blood boil to see the Sacklers continue to perform for the media, offering a few reputation-polishing facts, but never telling the whole truth. Other parties involved, who I thought had undertaken with me not to discuss the case during the proceedings, sang like canaries. Not me. This book was the outlet for my anger, and in retrospect, I believe it made witnessing the process bearable. My only recourse was to take my rage and my frustration and, once again, funnel it onto paper. In a perfect world, would Purdue even exist? I can't say. A friend asked me if we couldn't just pull OxyContin off the market. It was a sassy question, but I had to give a serious answer. No, we can't. Ironically, we have to keep selling it. As I write this, Purdue is currently worth a little more than $1 billion on paper. The settlement they reach will be 10 to 12 times that value. If they're going to pay their debts, they have to keep selling Oxy as a restructured company. I had an idea to liquidate the company, take that $1 billion, give it to the victims, and call it a day. Walk away. My suggestion was practically laughed out of the room. Progress is often less expensive than maintaining the status quo, and when it comes to implementing change, we're so often told there's no money for that. There is money. Other people wanted to get paid more than they wanted to do something meaningful, something that could potentially save millions of lives. The paycheck won out every time. The goal of my work has never been to ban or outlaw opioids. Opioids aren't the problem. Greed is. Reckless capitalism is. Gross wealth inequality is. A so-called justice system that shields the ultra-wealthy from the consequences of their actions is. A government that